What was challenging for you?
About our arrangement?
Yeah.
I I loved it. Um, we didn't yeah, I didn't have anything. It was very clear to us that we wanted to be spending time with these people and that that was priority. Everything else about the pandemic was challenging, but the actual pod arrangements themselves, the the challenge was like negotiating everyone's needs. And but I think and sure it
Wait a
was
minute, and
challenging.
needs meaning alone time, quibbles,
No, no,
what's
it
that
was really
needs?
it was the rules. It was knowing what the rules are.
You should tell about the contract.
Yeah, so it basically became clear really quickly that there was no way that we could, that I don't know the details, but I'm sure that it was 4 families at this time.
And you couldn't wing it.
We couldn't wing it. We couldn't be like, "Oh, we'll find out." It was like, no, it felt life or death, right? No, we cannot
Yeah.
infect the grandparents. No, you can't just go and hang out with this other family on the weekend because the stakes back then, before
Right.
vaccines, when we didn't know the extent, was that somebody could get sick and die. So the stakes were very high. We had to all be on exactly the same page about our commitment to this like pod arrangement. So I brought out some tools from work. Um, at work at that time, I still I run a national technical assistance center for state governments that support people with disabilities called the National Center on Advancing Person-Centered Practices and Systems. And it's essentially technical assistance center that's funded by the Centers for Medicare and Medicaid Services and the Administration for Community Living, so HHS, that is there to support states to comply with requirements for making good, like strengths-based, life-affirming, inclusive service plans for people with disabilities. And there's all kinds of tools that have come out of that movement, started as like a disability movement and then became adopted by the federal government. But there's all these tools for like families, chosen families, circles of support to negotiate what a good life is like for a family member with a disability. So we basically took some of those tools and modified them to negotiate what our life as a pod needed to be like. And there were all kinds of like tools that came in handy, like how do we balance quality of life with health and safety? And how do we balance multiple people's priorities and needs? So we went through this, like we spent like a couple hours one day together, all 8 of the adults while the kids played, and mapped out on a big sheet of paper what how do we hope to be together? What is the ideal way we can spend the next ride out COVID together as a community? What are the ways that this could go bad? What are the ways that this could go wrong? What are the things that we need to do and agree to that will lead to the ideal state? And then what are the things we need to not do that will result in the undesired state? And we like mapped it all out. And we came up with an agreement together. And we wrote it down and we abided by it. And it really, truly, it worked beautifully.
Yeah. And how many items are on it?
I don't remember. There were like 20.
Yeah.
I think we divided it between
It's like a
things to
quadrant.
do and things not to do.
Yeah.
But yeah.
Okay.
Yeah. They were like, and it got super concrete and specific. It wasn't like be nice to each other. It was like, we all agree that if somebody's uncomfortable with something or scared about something, you have to tell other people. It's your responsibility to tell other people.
Yeah.
We all agree that we will, like, whoever is least comfortable, whoever is most nervous about something, we'll listen to that person. So it's not going to be like, oh, Erin is worried about us going to the movies, but the rest of us want to go to the movies. And we're going to go to the movies. It was like, nope. In that situation, Aaron is still worried about the movies, so we're not going to go to the movies. We have to all agree that it's cool to go to the movies before we go to the movies.
Yeah.
So we made decisions like that. We made decisions like, can't hang out with the grandparents. Or if you hang out with the grandparents, then you have to step away from the pod for a week. Like, whatever.
Yeah,
like
stuff like that.
CDC guideline informed.
Sure.
Yes, we just wrote it all down. It went in writing. And we abided by it for months.
Yeah. I think that we all took it seriously because it mattered that we had the support network. And I think that, I don't know if we ever got sappy about it, but I think that we abided by it because it was really important to us to have our friends be a physical part of our life.
We started the conversation with why does it matter? Why does being together matter? Like, why does being in this community with each other matter? There's no way we could have done it if we hadn't already been friends.